Regurg, most common symptom, progressive distant exertion. Don't you even feel like a broken record right now? So any type of valvular heart disease, that is non-specific finding. Physical examination, what kind of murmur? Between S1 and S2, it's holosystolic murmur because of backward regurgitation. It's heard where again? It's a systolic murmur heard at the apex. Where is that? It is by your fifth intercostal space. Now here, it could potentially be located, maybe laterally displaced because you have a larger left ventricle. But this is a systolic murmur, holosystolic. Blowing quality, pulmonary rales, sure, especially with acute. Echo, you're going to find regurgitation. You find a large left ventricle. Surgical replacement of the valve, and maybe, if it's bad enough, surgery should be performed before the onset of CHF. That's one of those things that you worry about immediately because of volume overload to the left ventricle. But really, with any type of valvular heart disease, you want to prevent your patient from going into heart failure. It is imperative, as you being a first-year resident, to make sure that your auscultatory skills on the chest is second to none. It's amazing as to how many lives you'll be able to save. Symptoms of CHF should be treated. Goal of medical therapy, what are you trying to do here? You're trying to get it so that you reduce the afterload, and you try to decrease the pulmonary veins, and that may result in hypertension at some point. Okay, so those will be more of the medical therapy, and you're doing everything in your power to make sure that you prevent the patient from going into further congestive heart failure.